This is important. What are the determining factors when spinal manipulation is delivered to our patient that will determine their clinical outcome? In other words, what must take place in the spine to have a positive benefit from manipulation? Well, here's a paper that was published by Song et al. In JMPT in 2016, showing that there was a drop in anti-inflammatory and an increase in anti-inflammatory cytokines following spinal manipulation. Flanagan wrote about treating the craniocervical junction, that is the occiput sitting on the first cervical vertebra called the atlas. They call this a potential choke point. Today we know that through the jugular foramen passes the 7th, 9th, 10th, and 11th cranial nerves. So in using a technique called foramen magnum pump, we are affecting craniospinal hydrodynamics and neurodegenerative changes. And this paper by Flanagan in Neurological Research International says that this choke point may be a factor in neurodegenerative diseases such as Alzheimer's, Parkinson's, MS, amyotrophic lateral sclerosis, as well as many other neurological conditions, including hydrocephalus, idiopathic intracranial hypertension, migraines, seizures, silent strokes, affective disorders, schizophrenia, and psychosis. I didn't write this paper. It's done, published in a very erudite journal, certainly is a stimulus for physicians who practice spinal manipulation as a potential reason for the delivery of what we do. So what is this craniospinal hydrodynamics? What's the relationship between blood and cerebrospinal fluid flow, the pressures in this very close confine of where the human skull sits on the top of the vertebral canal? Drainage of dural sinuses, veins, lymphatics, blood are regulated by this craniospinal dynamics that we treat with spinal manipulation.